Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hi, happy Friday, my friends. Here, Joa Rivas, presenting you the Joa Fitness Show, which happens every Friday. We're bringing you information about how to get a stronger back and forget about back pain. And this is related to all the spinal dysfunctions that can be affecting all the audience listening right now. I actually had scoliosis when I was 15. This affected my back for 10 years with chronic back pain, going to sleep with pain, sleeping with pain, and waking up with pain. Literally like 24 hours with pain is not fun. It was about 10 years of this issue. After practicing yoga and Pilates for about 5 years, I started noticing changes in my body. I also had amazing therapies and professionals that helped me to understand what was happening to me. Unfortunately, I had to take painkillers because the pain sometimes was really hard to go actually in a regular day. So I actually had to take painkillers, which is, it doesn't make me too proud. But I'm here now. I'm 37. I started with that journey when I was 15. So it's been more than 20 years. And now at 37, I feel like a young teenager. I have no pain on my back, and I actually love to spread the voice of awareness, of posture awareness. And today we are on the week 3 with Vincenzo Romualdi, who is a chiropractor and a kinesiologist professional that has actually traveled the world and been able to explore all the alternative ways to incorporate a holistic approach to his clients. So he practices from a very deep level of understanding the emotions, the mental state, to provide a physical or a solution that can help to reduce and relieve pain. How are you, Vincenzo? Today is a beautiful spring day, nice and sunny.
I'm good, Joa. Thanks for that introduction. And I want to touch upon something you mentioned already about awareness. Awareness is key because unfortunately, a lot of people wait until they're in pain to deal with whatever they're going through. But if you're become aware before you're even in the pain, that's probably the best thing you could do, not just for your body, but for how you're functioning and your overall health.
Exactly. Becoming aware is not only becoming aware when the pain is already there, but when certain signs can come and show you. It can be either a physical pain. It could also be a mental blockage that you may feel. It could be a behavior that you want to change. It could be a habit that is something that you are repeating every action, and you just notice that this is actually causing you an issue or self-sabotaging the process of becoming a better version of yourself. So that's what I like about the talks that I have with all these professionals, because even though they're really talented in what they do in their professions, they actually see always the big picture as a human, that we are very complex. It's not only one thing. We're all connected in the same, which is a connection between our body, our mind, and our spirit as well. So Vincenzo and I, we met at the Inward Spa, which is an amazing spa here in the city of Toronto. I'm a yoga and Pilates teacher. I'm also a health educator. And I love to train my body because it's actually therapy, right? For my body, it's more of a therapy. If I don't exercise, I start feeling back pain. So movement for me equals therapy. And at the same way, as I'm training really hard, I love to recover really hard. And one time I was doing my recovery session and he was there, helping us to connect to the breath work while we're doing cold plunges and cold exposure, and also connecting to the heat too, because some people manage the cold better than the heat. So very interesting for me. I am one of those. I actually struggle to be longer on the sauna, on the cold plunge. And he was teaching us how to breathe properly, doing this great awareness about how to take deep breath. And also we practice some humming and chanting. And Vincenzo is a great singer. He was doing his vowels to connect to his cords, to his vocal cords, and it was really nice. So that's how I actually met Vincenzo. We've been talking now for 3 weeks and sharing great topics that could bring some insights for you, and perhaps you're going to start practicing some of the simple but very powerful techniques that we're sharing. So today we actually wanted to dive deep into sciatica, which is one of the most common dysfunctions in the body. And I wanted to start from the beginning, understanding what's the sciatic nerve and what are the main causes of sciatica. So Vincenzo, why don't you just help us to understand, for those people that are experiencing sciatica, and perhaps it's the first time this year, or perhaps they're been having a severe issue for many years. What's sciatica?
So your sciatic nerve, first, let's talk about that. It forms in your buttocks area. It comes from the lower nerve roots of your spine and your sacrum, and they is about 4 to 5 nerve roots, and they join to form your sciatic nerve. And your sciatic nerve itself runs down the back of your leg and into your foot. So in terms of what causes sciatica, there's multiple causes of sciatica. A lot of what I deal with has to deal with piriformis syndrome. Now, the piriformis muscle is a muscle that runs from your sacrum. So if this is a sacrum at the bottom of your spine, it runs from your sacrum to your hip joint. And you can look this up to get a better image, but essentially, if the sacrum is nutated or rotated at all, can create tightness in that piriformis muscle. And the sciatic nerve itself runs under the piriformis muscle, or depending on your anatomy, can actually run through the piriformis muscle. Obviously, if your anatomy makeup is so that the sciatic nerve is running through the piriformis muscle and the muscle is tight, you're going to experience a greater deal of pain going down the distribution of the sciatic nerve. But if your genetic makeup is so that the sciatic nerve is running under the piriformis muscle and that muscle is tight, you can still experience some symptoms as well. And so if that is the case where you have a piriformis syndrome or a tight piriformis muscle causing that sciatica or contributing to sciatica, then that muscle itself or the rotation of the sacrum causing the tight muscle needs to be addressed. Mm-hmm. But another big reason why people have sciatica is from the nerve roots the sciatic nerve comes from itself in the spine. And these nerve roots can be interfered with due to things like disc herniation or narrowing of the IVFs. And that can happen from degeneration of the spine or injury to the spine, hyperextension. And so that's another thing that can be addressed. So to address the sciatica, you really have to find out what's causing it in the first place.
Mm-hmm. And we wanted to dive deep into 3 main causes, because the causes could be so many, but we actually chose top 3. So number 1, we actually talked already about the piriformis muscle, but specifically we're talking about a pattern that it could be happening because you are wearing a fat wallet. So this is actually called the fat wallet syndrome, which is for those normally men that used to wear those thick wallets, hopefully full of money, hopefully not full of receipts and bills, but let's say full of money, these people, and they wear the wallet, and it's very thick, and it creates an imbalance in the hip. So if they're sitting, they're driving, and they are unconsciously wearing this fat wall, then this is creating an imbalance on the hip, especially if you're doing it for many years, which is something that reminds me to my dad. Back in Venezuela, I love my dad, and unfortunately he has been having sciatica since when he turned 50. He's now 77, so he's been over 25 years having this very deep pain that is a sciatica, but it actually goes through the spine. So sometimes he feels pain on the lower back, sometimes the pain shoots down to the toes, and it goes really bad on the leg. But it's definitely not good when I hear these stories of my dad, because he used to be very active, and this is actually decreasing his performance. He's not able to walk for long period of time without stopping to be able to stretch, because the pain is like fire. It's like a burning sensation that it creates a mental blockage. To be honest, it could affect your mental health as well. So this is one of the first causes. Is actually for those that are wearing a fat wallet. Can you please tell us a little bit more about what's happening in our hip when we are having something like a pattern, like a fat wallet, like wearing a fat wallet?
So it's not only fat wallets, it's thin wallets as well.
Thin ones.
And
like no money, like
a normal wallet,
empty
literally anything in your back pocket you shouldn't be sitting on, especially for long periods of time, because what that does is create an imbalance in your spine. It's a repetitive stress over time, right? So how that occurs is if you're experiencing this repetitive stress from whatever you're sitting on, let's say you're driving to somewhere that's far away, or you're sitting at your desk working all day. When over time, if you have this slight imbalance, it creates an imbalance in your hips, and eventually your other parts of your body will compensate for this imbalance, potentially rotating that sacrum or making that piriformis muscle tight. Could also affect the nerves of the low back as well, right? So this is definitely something you need to focus on when you're addressing sciatica and piriformis syndrome.
And this is kind of like wearing insoles, right? So imagine if you have insoles on your left shoe, but not in the right shoe. So you're literally just making an imbalance there. So one side is going to be shortened, the other side is going to be longer. Definitely something's happening.
Yeah, that's a great point. I urge you to even test it out yourself. If you need to get a napkin or a piece of paper and fold it a couple of times and put it under your heel and walk around with that, even for half an hour or the whole day, if you really want to challenge yourself, you will notice the imbalance right away. And that's just one day of doing something with this small imbalance. Imagine what hours and hours and hours is doing to your low back and pelvis.
Totally. So for those people that are actually still with that habit of wearing something on the pockets and actually using it for the whole day, make sure that you're not doing that anymore. Now, number 2, let's talk about the disc herniated, like hernia. What's happening exactly on the spine that is connected to this specific nerve? That's the most common cause of sciatica. Can you please tell us more about this cause?
Yes, of course. So disc herniations themselves, the discs of your spine are found in between the bones. So you have bones, and in between the bones, the vertebrae, you have the discs. They act as shock absorbers, and they're layered like an onion. And right in the middle of the disc, you have the nucleus pulposus. And what happens with a disc herniation, there's obviously different levels of disc herniation, but what happens with a disc herniation is these layers start to rupture, start to tear, and the nucleus pulposus that's in the middle starts to seep out into the outer layers, and in severe cases can even seep out into the disc space itself and create a bulge. Now, this bulge is what impedes the nerve, will put pressure on the nerve root itself at that specific location. So for instance, let's say it's your L5 nerve root that's being impeded. The distribution of your L5 nerve root can be affected. And sometimes it can just affect the L5 nerve root, but sometimes it could also affect the sciatica nerve root as well, because the L5 nerve root does go into the sciatic nerve as well as some other nerve roots that form the sciatic nerve together. So with disc herniations, it obviously takes a lot more time and care to correct if that is what's causing your sciatica, because disc herniations typically, and again, depending on the severity, take anywhere from 3 to 6 months to heal on their own. So with proper care, it can heal faster, but addressing that cause and finding out that cause is the first thing you need to do in order to address it properly.
And the number 3 is, for those listening to the podcast today, is actually the pregnant woman. Actually, pregnant woman, they not only get more pain on the back, on the spine, but they actually have this tendency to start generating that sciatica. So could you please tell us about that third cause, the pregnancy?
Yeah, so with pregnant women, obviously they're carrying a lot more weight on their front side of their body, and their backside is compensating a lot for that. But what also is happening is when the baby starts to grow, it starts to increase their intra-abdominal pressure. It starts to increase the pressure within their abdomen. And this can lead to pressure on the nervous system and can eventually lead to sciatica. So with pregnant women, typically, unless something ruptures or something creates an injury that will last longer than the pregnancy, typically the sciatica will only last the pregnancy until the pressure is relieved. But sometimes it can cause other issues post-pregnancy as well.
Yes, I actually had a couple of years ago many podcasts related to pelvic floor and pregnancy. And I had actually a specialist of pelvic floor physiotherapist that she shares so much information about the body, how your hormones of relaxing so much in the area, and it actually stretches a lot, and that's why we can actually pull muscles easier when we are pregnant. So basically, can pregnancy trigger sciatica? It could, and also could do lower back pain too. So ideally, you want to make sure for all the women listening to the podcast to prepare before you're pregnant, before you're conceiving, to have very strong core and to be very flexible. So by the time you're pregnant, your body is in a great position for the load that is going to come after the third trimester, which is what's happening.
Yep.
Now, yes.
Sorry. Yeah. And chiropractic care is actually great throughout pregnancy because it helps to ensure that things are moving appropriately and there's enough space for the baby to grow and move and kick. And so making sure everything is moving appropriately and is as loose as possible, chiropractic care is great to help with that throughout pregnancy.
Yes, exactly. Now, one thing, now going a little deeper into your practice that you do holistic approach, if you get, let's just play the role, I come to you, I'm having this experience of lower back pain, but now I feel like a burning sensation and throbbing around my leg. It goes down to my foot. What are there specific ways for you to test that someone has sciatica and it doesn't actually have a deficiency of activation of the leg or some type of other injuries that is actually not sciatica? Do you have a specific test that you do, or do you actually ask them to go to get an MRI directly? That what's the best approach?
So MRI can be warranted if the cause of the sciatica is a disc herniation. But even if they have a disc herniation, if the person testing, the chiropractor testing, is educated enough, they can do tests that are just as good and valid as an MRI in determining if that patient has sciatica from a disc herniation, or the patient has a sciatica from a piriformis syndrome, or whatever the case may be. So if their testing is adequate enough, it's just as good as getting an MRI. So MRI is great for disc herniations, but kind of not a last resort, but something you want to make sure you're doing everything you can before sending the patient out for testing.
For an MRI. So once you detect, you do this testing, which what do? You just the patient is laying down on the bed, and then the person lifts one leg. Normally, what is the regular test that you do?
So the test we do as what I do in the office to test for the sciatic nerve itself has a lot to do with the distribution of the sciatic nerve and what those nerves control. So I test things like orthopedic tests, so I'm testing the motion of the joint as well as with the muscles that it affects. Also myotomes and dermatomes. Myotomes referring to the muscles that nerve root controls, or dermatomes, the sensation where those nerve roots go to in your skin. So we test different things in the office to make sure that we're getting all the information we need to make
so you just kind of checking
the
reflexes.
Yeah, reflexes are part of that too.
Okay. And then after the person is diagnosed, but tell me a little bit about the word diagnosed, how hard it could be in somebody's mental state.
Yeah, the word diagnosis kind of comes for me with a negative connotation. I try to stay away from that, just because when you use the word diagnosis, it kind of leaves the patient feeling like that's what they have and they can't do anything about it. It's too late, but it's never too late to start doing something to better your health, to better your body, to better your function, to better your ability to heal. So in terms of the word diagnosis, I try to stay away from it just because of the negative connotation it holds. And I always try to empower my patients to let them know that there is something you can do, maybe not to restore it completely, whatever your condition may be, but there is something you could do to slow down the progression of it from it getting worse in the future.
So do you use another term for it instead of diagnose?
I just try to stay away from it in terms of what I use. It's specific to the condition they have, I guess. So if they had sciatica, I would say, well, I would explain why they have sciatica instead of just telling them. I like to teach my patients exactly what's going on with their system and exactly how my care is helping them get better or helping them not get worse. So I like to teach my patients in depth as to what's going on with them and how chiropractic care can help. So instead of saying you have this, I'm saying this is why you have this and this is what we can do about it.
This is, yes, exactly. Now, coming from that, again, that process, okay, you detected this possible issue. Then after, you do some type of like nerve stimulation, muscle stimulation. Do you give them a set of stretches for them to do daily, some type of like cold and heat therapy? What normally is the process after someone is detected with sciatica?
That's a great question. So what I tell every single one of my patients, regardless of the condition they have, or if they're just trying to be the best version of themselves and function optimally, is I tell them the changes I'm making here in the office are just as important as the changes you make at home. And the reason I say this is because it's what you've been doing away from the office, at home, at work your entire life that has brought you into the office in the first place. So even if there's small changes, like the way you sleep or drinking enough water or implementing some stretches or exercises related to sciatica, you definitely want to start implementing some stretches and exercises, but coupled with chiropractic care, because more times than none, especially if it's a piriformis related issue, the piriformis muscle is tight because of the structures it's attached to and the malpositions or the misalignments that these structures undergo. So my job as a chiropractor over time is to implement a change in the habits of your spine to make sure it's functioning better, to make sure these muscles are relaxing, and to make sure your nervous system is flowing body to brain and brain to body at its best. But then to couple that chiropractic care at home, the changes you make specifically with sciatica, some stretches or some strengthening exercises, typically to stretch what's tight and strengthen what's weak.
Exactly. Well, coming from that approach, I remember my dad. It's been over 25 years with sciatica, and as not only yoga and Pilates teacher, but I'm always searching to alleviate and to make this life path much enjoyable, and nothing like to having a quality of life. So when I hear my dad has sciatica, I've been always researching and reading, trying to understand what could be a solution. He is still going to some therapists, but he gets the most relief by practicing stretches daily, by doing some cold plunge for reactivation of the nerve system, and also some gentle mobility that is just stimulate enough to just keep the body moving. I understand, and this is something that I want to tell you, if you feel frustrated and just want to give up, because I'm part of many Facebook groups of sciatica for the same reason. I like to listen to stories. I like to see other doctors' opinions and alternative solutions. Many people actually write daily, like, I'm crying, I cannot move, I want to quit my job. They feel so exhausted and mentally drained from this issue. It's a physical issue, but affects so much the mental state. So if you are passing through sciatica, I still first suggest if you could actually find a professional that can help you. It can have you hand by hand in the process, while you, like Vincenzo says, you are the captain of your ship. So yeah, you have a great amount of time for you to stretch, to break all those patterns and habits. Actually, last chat that we have was about breaking old habits. So whatever took you to be there, it's time to just break it and create the new habit that is going to help you. So I think this is all important. We cannot only go to the physiotherapist or the chiropractor to find a band-aid when we're still doing those habits are affecting and creating the same underlying issue. So I think it's a lot to do with sciatica, but I think this hopefully brought you a little different perspective, understanding that sciatica is not only a physical issue that will affect your physical body, it will also affect your mental health. And remember that breath work is powerful. There are so many books that teaches you how your mind and your body is intrinsically connected. So if we can start bringing some attention how we're breathing, and that will also help you to calm down and also to release any anxiety that could create this type of spinal dysfunction that can really be very very difficult to go through. So Vincenzo, do you want to share any other tip for those that are really suffering of a severe sciatica that are listening to this topic together?
For people who already have sciatica and in pain, I would advise them to seek a professional, whether that be a chiropractor or physiotherapist, to make sure they're being cared for, not just at home, but in the office as well. And for people who are not in pain yet, don't wait till you're in pain to do something and make a choice for your health for the better, because pain is the straw that broke the camel's back. Don't wait for your straws to pile up and your body to scream at you to make a positive change and impact in your health and life.
Totally. Yes. Well said. So, well, I am excited that the weather is changing, and I'm going to take a walk after this call just to take a deep breath and have a little mental break and continue working. And I can't wait for next week. We have the last talk with Vincenzo. So if you actually been listening to our talks every week, we actually bringing information related to the spinal health and how Vincenzo on his practice with his background and his experience actually helps his community. And remember that we are all in a family. We just realized about that through the pandemic. Whatever happened to someone in the other part of the world was affecting us. So I think it's so excited to be together in this path of really relieving pain and also connecting to our body through awareness. Very important. Thank you so much, Vincenzo. I hope you're having an awesome weekend. And last weekend, by the way, we went to the Cold Deep on Saturday. It was on the Lake Ontario, and it was over 300 people, enthusiasts that went into the cold water. It was about 2 degrees outside. I'm not sure how cold was the water, but it was a great attendance and community connection to empower ourselves through breath. And 2 minutes on the Cold Deep, it was great. So I can't wait to continue growing a community with high consciousness and helping each other, because this life is so much fun when we actually share these experiences together. Vincenzo, thank you.
Thank you, Joa.
Thank you. I will see you next week. Have a beautiful weekend. Have a beautiful weekend, my friends. Remember that together we are stronger.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.